Hello, my name is Dr. Shahabi-Azad. I am co-medical director at Highlands Rehab Hospital, and I'm here today to talk to you briefly about some general concepts about brain injury. So, first and foremost, one must ask, what is a brain injury? And so there are two types. One would be traumatic and non-traumatic. And so those two keywords are self-explanatory. So oftentimes when we have folks who fall down and hit their head, people who are involved in motor vehicle accidents, and sometimes people are involved in physical assaults, those situations often lead to a traumatic brain injury. And then our non-traumatic brain injuries, that can be sort of things like cancer, stroke, or anything that didn't relate to an actual force applied to the head. Now, in both instances, the recovery process is actually quite similar. Usually, a lot of the brain recovery occurs in the first 3 months. So it's really important that you get seen by your physician, your primary doc, and people like myself who are rehab physicians to focus on how we can accelerate your recovery during that opportunity. Now, after 3 months, you're still going to be healing pretty darn well, even up to a year. And sometimes we've even seen some reports where people who have brain injuries can even heal up to 2 years. But that's going to be accelerated by comprehensive care in facilities like Highlands, where we can actually focus on brain injury with rehabilitation and medicine. So whenever, oftentimes people use the word concussion. And so a concussion is equivalent to a mild traumatic brain injury. So those two key words can be used similarly. And so how you define that, that could be a whole nother lecture, but essentially, oftentimes one of the easiest things we can look at is whether there was loss of consciousness when someone had a brain injury. And also when you get to the hospital, we can get imaging to look for any sort of bleeding or other types of problems in the brain. And then we can categorize whether you're mild, moderate, or severe. And depending on what you're categorized as, it can kind of influence your recovery process and our approach as doctors to try and get you better. So hopefully, for anyone out there who may be experiencing symptoms of traumatic brain injury, there are people out there who understand it, like myself, and so we want to be able to help you out definitely. So, but that's hopefully a general idea on what traumatic brain injury is and non-traumatic brain injury as well.